I'm Carolyn Prytherch Roberts, and I'm the Senior Dental Nurse for North West Wales, basically Gwynedd and Anglesey. I'm based in Llanfairpwll, but I cover from Holyhead down to Dolgella, from Pwllheli all the way to Llandudno Junction, so I've got quite a big patch, and there's about 21 members of staff in my line management at the moment. My main duties include preparing the roster for the week. I try and do that a few weeks ahead as well, so we know where we are, approving annual leave, arranging short notice absences. I also do personal development reviews as well for the staff. Maternity leave, I try and guide staff through the policies to help them get a work-life balance as well. As senior dental nurses, there's 5 of us across North Wales working for Community Dental, and we take clinic audits, risk assessments, and we're part of some meeting forums as well that help the directorate. So yeah, we're quite busy. We do the hiring as well, so we're part of the interview process. We prepare all the documents to go through the approval process. It gets approved, then we sort of head the interviews as well with other colleagues. So yeah, and a lot of training as well. We do a lot of training this end as well. In-house training. We've had trainee dental nurses in the past. We've had special, post-qualification courses running, and that's part of mentoring them as well, staff, to be able to move forward in their careers, and also, supporting new trainee dental nurses as well. I don't think there is a typical day. It can vary from a very quiet day where I've had no phone calls of staff. There's nothing on my to-do list. They are very rare though. So, you get up in the morning, sometimes you look at the work phone and there's a couple of messages, childcare issues, or somebody's off sick, or something else has cropped up. So you've got to deal with that, and you've got to provide short notice cover for other clinics as well. Then depends what's on my to-do list. We might have a meeting coming up, so you prepare for that. And I also like to keep my hand in with a little bit of nursing as well. Not as often as I used to do, but I try and keep a little bit of nursing going as well. Start setting up the surgery. We've been doing these AGPs recently with COVID, keeping my hand in on the ground as well, because I enjoy it, and I like helping staff. Life happens and people still want to work, and being able to find the right approach for people with their well-being, supporting them to stay in work as long as possible, going through flexible working, work-life balance, possibly helping to refer people to the proper and appropriate places if they need that, or just being a bit of an ear to talk to as well. I'm a good listener, but I'm a better talker as well sometimes. But yeah, it's very satisfying as well, and it's nice to see the end result when the patients are happy, because you've got a happy team as well. So I think the end thing is the patient. So yeah. Well, I fell into dental nursing really. I actually started at the age of 14. I was a Saturday girl in the local practice, and I did that until I went off to university. That didn't quite work out for me, the university. So I looked in the paper and there was a job for a dental nurse, and I'd moved to Wrexham at that point to be in uni. Anyway, I got the job, and I ended up working for Mr. Alan Barclay in Rwabon and Cefn for about 2 or 3 years after that. He was very encouraging and very supportive, and he actually encouraged all his staff to sit the national examining the NEBDN national certificate. So off I went to Chester. That was the nearest course at the time. 8 months later, I sat my first dental exam, passed it, and that's where it all began, I think. So actually, when I qualified, the practice that I'd worked in as a Saturday girl, they actually phoned me up. They wanted a qualified dental nurse at that point. So I came back home to Bethesda, and I worked there for another couple of years. Again, I saw an advert in the paper for a community dental nurse, and we'd heard so much about community as being part of the course that was the job that we wanted. Got that job, and I've been here ever since. So from doing that first exam back in the mid-90s possibly, I then went on when I joined community to do my other post-quals. So I've done my sedation, oral health, special care, radiography, extended duties in fluoride application, impression taking. I've even helped out on the delivering the course as a teacher as well, so teaching the national certificate. Became an examiner with the National Exam Board from 2004 to 2016. Then I got the opportunity to become senior dental nurse, so applied for that job, got that one as well. So yeah, it's been a bit of a lucky career course, I think, but it's one I haven't looked back on at all. I'm a fluent Welsh speaker. I think I'm lucky enough to be very bilingual as well. I've been lucky with my family that we've got a very strong Welsh connection, but we've always got an English connection as well. So bringing that into work, it's natural. So speaking with staff, patients, it's a natural progression. But we do have some staff that don't speak Welsh as fluently, so we always encourage them, teach them a few phrases, teach them a few naughty phrases as well sometimes. But it's a good way of being able to put the patient at ease, because you can communicate with them through their first language, and then you can tell the dentist or therapist or other nurse with you, this is what they're saying, and you can have this three-way conversation. And being bilingual, that comes quite naturally as well. So if somebody was to come in, yes, we'd encourage you to learn Welsh, but it's not really a barrier if you can't, because most of the staff can and can do it quite well as well. I definitely think that the networking has improved over the last 10, 20 years. I mean, dentistry is a very close-knit community anyway, but being part of the Community Dental Service, we span across the whole of North Wales, so we're one service, whereas usually in a trust this big we have three separate bodies, but we're one. So we have staff training days pre-COVID that used to involve all of us, nearly 200 of us getting together, networking. I'm not sure how it is because I've been out of general practice for a while now, but I do think that with COVID restrictions, it's sort of brought us closer. Even though we're not physically meeting at the moment, we're all on different teams training or on Blackboard training. So we're seeing people, and although we're not communicating with them, we're seeing people from different practices. And being fairly local as well, being part of the West community, definitely, we've got staff that work in Blaenau Ffestiniog, Holyhead, and because they're local to those areas, that's our little networking as well. Training used to be 30, well, for dental nurses, it used to be a 30-week evening course, but that's expanded as everything's changed with the National Examining Board, and definitely opportunities for training have increased, where we've been having, when I was sitting a lot of the exams, you had to go to Manchester or Liverpool, but now you've got the opportunity to sit it a little bit more locally, so you're not having to get up at silly o'clock in the morning to travel or spend the night over there. So training and networking has definitely come a lot closer, I think, in the last few years. Well, I live in a little village called Bethesda. It's about 6 miles south of Bangor. I'm based in Llanfairpwll, so it takes me about 10 minutes to get to work, traffic depending obviously, but like I've explained, we've also got clinics in Holyhead, Dolgella, so it can take a little bit longer to actually travel to work, but the drives are spectacular. I don't think you can have drives like this anywhere in the world. Most of our clinics have got beautiful views in them, and if you haven't got a direct view from the clinic, the drive alone is just stunning. I'd rather drive for an hour than be stuck on the 62 or whatever for 30 minutes. But yeah, it's beautiful. Like I said, I live in Bethesda. I was born and bred there. I moved away for a couple of years. I came back. I'm a home bird. I like being close to my family and friends. So I'm excited to stay around here. And I think I've been quite lucky to have such a supportive career in my local area. I've not had to move away. But if anybody was thinking of coming here, there's just so much to do. There's rich Welsh history. You've got, in Bethesda where I live, you've got the quarry. Now that's one of there was a massive strike there, the Strike Fawr in the 1900s. And that was basically the start of the unions. So that there's history there. You've got both the bridges going over to Anglesey and Thomas Telford, Robert Stevenson's bridges, the first railway to span from London to top of Holyhead. You can go further back to the Mabinogi. The Wyddfa is supposed to be a burial chamber for a giant, according to local legend. We've got cairns, we've got burial chambers, and actually in Carnarvon we've got Saguntium, which is the Roman settlement that was there in the 3rd century. So there's that if you're a history buff. If you like to relax, we've got beaches, there's forest bathing, we're full of forests. If you're a bit more adventurous, you've got kayaking on the lakes, mountain biking, bouldering, rambling, walking. There's a lot of projects going on with the cycle paths at the moment as well, and the coastal paths. So there's basically something for everybody up here. Definitely something for everybody. That's all I'd say.